Hello everyone, this is Dr.Akshata Shanbhag. Today we are going to learn comparative study of sulfur. So before we understand action of the drug. So it acts mainly on the mucous membrane where it causes acrid, excoriating, catarrhal discharges. All fluids will burn the parts on which they flow. And it also has action on the skin where you find eruptions of all sorts: vesicular, pustular, furuncular, scaly, with much itching and burning is present. Then you find that it is one of the dangerous medicine to give where there is structural disease in organs that are vital. So as we know, the sulfur is considered as the king of the antisoric. So soric conditions we can think of this drug, but structural diseases of the vital organs when they are there, like in the heart, lungs, brain or the liver, etc. So there you should not think more of sulfur. It's a general broad antidote especially to the mercury, and it is used when there is paucity of symptoms, that is when there is very few symptoms present in the case and all orifices of the blood are red. So it has main action on the circulation where there is deranged circulation leading to congestion, and the orifices, wherever the orifices are present, like the lips, ears, as well as the lids, the edges of the lids, anal region, vulva, urethra, all these areas you find redness. So now we will see the comparisons. So we know that sulfur is considered one of the trios of burning. So trios of burning we have arsenic, phosphorus and sulfur. So arsenic is used in all acute diseases. If there is burning, then arsenic will be useful. So while in phosphorus both in acute and chronic diseases, sulfur basically in the chronic diseases is much helpful. Then if we compare bryonia and sulfur in rheumatism, so as we know both have action on the serous membrane. So bryonia has rheumatism with effusion and the swelling is very prominently present in the bryonia. While in sulfur, rheumatism with effusion or this stage has passed away and only the inflammatory process are to be gotten ridden of. Okay, so with all this, burning must be prominent. If you want to choose sulfur for the patient in rheumatism, then there has to be burning present and effusion may or may not be there. But after effusion, if the inflammation is signs are still there, like redness is there or the warmth is present with burning and all, then sulfur you have to think. Now comparing sulfur, chamomilla, medorinum and sanicula, all four drugs are having burning in feet. Burning in feet, and they want to find a cool place for them. So they put them out of bed to cold them off. Okay, to make it cold, they will uncover the feet. Then Farrington says it can be used, even Kent says it can be used in defective reactions. So now sulfur and sorinum is told that whenever in skin affections you are giving treatment and it is not progressing in a healthy way, in effective way, then sulfur and sorinum can be used. So cupromet and loroceresis can be used in chest affections like that, and valeriana and ambragracia in the nervous diseases. Then carboveg is used in the defective reactions, especially in abdominal affections and collapse with cold breath, cold knees, etc. So the major difference between sulfur and calcarea carb. So we know that sulfur is lean, stoop shouldered, while calcarea carb are very fair, fat, flabby. And sulfur is very quick in action. They are very wiry and nervously active. So while in calcarea carb you find sluggishness or slow in its movement. Sulfur you find burning sensation is present in general, while calcarea carb coldness will be present in general. So sulfur has offensive odor of the body, and calcarea carb has sour smell of the whole body. So sulfur has diarrhea aggravation in the morning, early morning especially, while calcarea carb in the afternoon. Sulfur is not better when constipated. So while in calcarea carb they feel generally better when constipated. So sulfur you find action mainly on the upper portion of the left lung. So while calcarea carb has action on the middle and upper portion of the right lung. Then least mental excitement will cause profuse return of the menstrual flow. This you find even in the calcarea carb. Aggravation from mental excitement, there will be excessive menses. Then you find both the drugs are having amelioration from cold. So though there is coldness in the calcarea carb, they are better by cold. Then sulfur, baptisia and arsenic carb. So sulfur has drowsiness with fever, tongue is dry and red at the edges and the tip, and it responds very sluggishly and slowly. There is burning up with fever. So these you find in the fever condition in the sulfur. So this has to be there if you want to choose the sulfur. So while in baptisia there is sluggishness continues and goes to sleep even before answering. We know that there will be unconsciousness or the stuporous condition, and when you question them they will get up and they will answer the question. In the middle of the answer they will again go to sleep. So that you find in the baptisia. And here the tongue will be brownish or blackish color will be there, or hue will be there down its center. So while in sulfur we saw it is dry and red at the edges and the tip. So then in the baptisia there are sods form on the teeth, and the discharges from the mouth and bowels have an offensive odor. The face looks besotted look, or the drunken look will be there. The blood is actually decomposed from septic poisoning or from prolonged high fever in the baptisia. So ourself it is used in the inflammatory fever. There is restlessness, full bounding pulse, hot, dry skin, anxiety, fear of death, profound tissue changes will be seen, aggravation at midnight, burning thirst for small sips of water frequently, burning like coals of fire in the part affected. So this you find in the ourself. So tubercular hip joint, if it is there, so white swelling will be seen in the sulfur. So there if you further if you compare sulfur and the calcarea phos, so here you find sulfur, they are emaciated and the child looks very shriveled and dried up like a little old man. So calcarea phos, we know that they have a tendency to emaciation, while calcarea carb are fair, fatty, flabby. So here calcarea phos is emaciated and the abdomen will be very large but more flabby. Okay, though the whole body is emaciated, the abdomen will be enlarged. And in the sulfur the head is large compared to the rest of the body and with open fontanelles. So while in the calcarea phos, posterior fontanelles will remain open too long, and you will find the head is also large compared to the rest of the body. So apis and sulfur, if we compare, in both the drugs we find it is best in tubercular meningitis and the cerebral symptoms arising from repercussion of some eruptions, especially acute eruptions. That means if the acute eruptions were there and being suppressed by some ointments or some medications, okay, and then if they suffer with some cerebral complaints like convulsions, neuralgias or fainting fits, etc., so then apis should be thought. So while here and even apis is used in hydrocephalus, mainly the water accumulation will be there, fluid accumulation will be there. So dropsical effect you find more in the after effect of the other disease, suppressed diseases in the apis. So sulfur has the same such symptoms, cerebral symptoms, but in suppression of chronic eruptions. If chronic eruptions are suppressed, then they will suffer with the cerebral symptoms. Then here in the apis, well marked effusion in the brain will be seen. Sulphur, you don't find such effusions. So apis patient cries with a piercing shriek, especially in the hydrocephalus and all you will find this. So while sulphur cries out in its sleep. So apis is a sleepy child. They sleep but cannot, they are very sleepy but they cannot sleep. Suddenly awakes from the sleep with a shrill cry. The wholly or partly they are conscious. So while sulphur does not sleep at all, or starts up from sleep suddenly, or sleeps in catnap. So that you find in the sulphur. Then calcareous carb, silicia and sulfur, if you compare, calcareous carb and silicia is used in persons who always grind kaolin and various products used in the manufacture of china and stone workers. So stone workers and all the you can say occupational diseases or occupational hazards, in that you can think here. So in stone workers, in china manufacturers, so all there you will find calcareous carb and silicia helpful. So while in the sulfur can be useful in persons who work in the coal mines. So then aconite, sulfur and lycopodium if you compare. So aconite is used in milk fever or puerperal fever where the chill is only acute. Okay, puerperal is after delivery. If the fever continues, then there is aconite will be one of the drug to be thought. Then sulfur, you find septicemia, the feet will burn, hungry feeling will be there in the stomach, aggravation at night with sinking and exhaustion, sensation of steam arising or hot flushes you will find in the sulfur. As I said, sulfur has main action on the circulation where it causes congestion and all. Because so as I said, sulfur is having main action on the circulation where it causes congestion, redness, flushing, heat, burning, all those because of the circulation, deranged circulation. Then lycopodium has hot sweat and other general features you will find. So while one rigor follows the another in rapid succession, you will find in the lycopodium. So this in the fever conditions you can compare aconite, sulfur and lycopodium. Then pyrogen, ferrum and pulsatilla. So here also you find pyrogen, continuous intermingling of little chilliness and little quivering throughout the body. So again in the fever conditions only you can compare. So where you find more of chilliness present in the pyrogen, and the pulse is also lost its proper relationship to the temperature. So according to the temperature the pulse has to be increased. So there that won't be there. Then the ferrum, you will find purplish appearance of the body, the cold sweat all over, remittent or intermittent chills will be there, thirst only during the chill, and the face is red during chill. So this we expect, the thirst and the redness of the face we expect in the heat stage of the fever. So but during the chill you find the redness and the thirst in the ferrum. Pulsatilla, you see one side of the body is hot and the other side is cold. Then the tearful state, trembling with fear will be there. Nervous excitement with and restlessness you find in the pulsatilla. So these comparisons I have taken from E.A. Farrington Clinical Materia Medica, E.B. Nash Leaders in Homeopathic Therapeutics with Grouping and Classification, W. Borick Pocket Manual of Homeopathic Materia Medica and Repertory, Clark Dictionary of Practical Materia Medica, J.T. Kent Lectures on Homeopathic Materia Medica. Thank you.